how has your leukemia been followed over time, to see how are you doing? And can you explain for others, what treatments, what kind of testing you have and how the frequency of them?
Well, I take this medication every day, and I started out taking 2 pills a day, but that was a bit much. So I take 1 pill a day every day. And then I get my Vidasa injections 5 straight days every 4 weeks. And probably every 4 months, maybe, I get a bone marrow biopsy. And that seems to show a lot of improvement. And I like where the numbers are now. And that's about all I do. I just go every month and never fail, never miss a thing.
Tell us about the bone marrows. Are they painful, or do you get anesthesia with it, or just local type anesthetic?
I had a knee replacement prior to this, and I had a few pain pills left over. So I take 1 before I go, and then they give me, which they know I do, and they give me a kind of a relaxant pill 30 minutes before I get it, and it doesn't hurt at all. I have a great practitioner who does a great job, and I ask for her every time, and it doesn't hurt me at all. The only thing that is uncomfortable sometimes is the pressure that they have to use to get the bone marrow out. But that's only some part of 30 seconds. Everybody had told me before I went that it was going to be so painful. It hasn't been painful to me. And so I don't mind it. And so I'm willing to do whatever.